Thank you for joining today. My name is Matt Smith. I'm the Director of Training at Corvell. And before I turn it over to Jeff Gerchef, our host today, I'd like to let everyone know we're recording today's meeting, and we also have a Q&A pane. You'll see a link to open that panel in the lower right-hand corner of your screen. Please feel free to submit questions at any time, and we'll be monitoring that, and we will answer as many questions as possible at the end of the call. With that, I'd like to introduce our facilitator today, Jeff Gerchef. He is our Vice President of Enterprise Comp and Strategic Insights at Corvell. Take it away, Jeff.
Hey, thank you, everybody, and I'll give a quick wave so everybody can see who I am. As Matt said, my name's Jeff Gerchef. You may hear the folks on today's audio and video call me Gerch, so they're not swearing at me or they're not angry at me. It's a nickname I go by here within Corvell. So if you hear that, they're referring to me as Gerch. But as Matt said, I'm accountable for Corvell's claims organization, have my hands in our implementation management team, and then our strategic insights management team. Just briefly about my background, I've been with Corvell about 2.5 years. I've been in the business, and this came up just recently in a presentation we made, that I've been in the business more than 30 but less than 50 years, and we'll just leave it at that so you don't know exactly how old I am. But I'm really fortunate today to have with me a couple members of our strategic insight management team, both Mike and Mindy. So Mike, I want to hand it off to you just for a quick intro.
Hey, Mike, you need to unmute yourself.
I apologize. Thank you, Jeff. I've been in the industry my entire career and proud to be with Corvell more than 20 years. The first half of my tenure was in sales and operations, then moved into account management and data analysis, ultimately joining the SIM team.
And Mindy, how about yourself? Would you like to introduce yourself?
Good afternoon. My name is Mindy Powers. I've been with Corvell just shy of 2 years. I've been in the insurance industry for over 30, and I've held various roles throughout my career in the insurance field. And I'm so happy to be part of the Strategic Insights team at Corvell.
Thank you both. And just as Matt had indicated at the onset, there's a Q&A pane on the right-hand side. If time allows, we'll try to get to some of your questions and try to facilitate those at the end of our presentation. But I'd like to move forward with just a little bit about Cogency IQ. And why I want to talk about Cogency IQ just briefly is because the Strategic Insights Management team is part of Cogency IQ. But what exactly is Cogency IQ? Cogency IQ for Corvell is basically our analytics driver. It is a combination of different entities within analytics and within machine learning to bring together a team and solutions for our customers. Cogency IQ came about with Corvell a few years ago when Mr. Combs said, I know our clients, our prospects, the industry has all sorts of information coming at them at light speed and from various different directions. And what we really need to do is make sure that we can accommodate answering the so what in all that information that's coming at them. So born out of that thought and that process was our Cogency IQ team. And there's 3 basic functions or areas within Cogency IQ. The first of which is what I'll call our business intelligence piece. And our business intelligence piece is our BI tools. They're graphical UI type of tools that will display data in something very meaningful, graphs, charts that are usually interactive. So we have a team within the Cogency IQ team that brings together those different types of dashboards and facilitates information for our clients. The second piece within Cogency IQ is artificial intelligence and machine learning. And for those of you that are in the industry, clearly understand the importance of AI and ML and what that means for the future. Using tools to bring to the surface those things that are most important and those things that can enhance and change trajectory of claims. And then the last component, and certainly not the least, is the consulting piece. So the other piece that Mr. Combs said is not just the so what, but how do we make sure that we're consulting with our client? How do we make sure that we're a trusted advisor for our customers and with our account management team to assure our clients truly know what's happening and what they can do differently on their program. Intelligence consulting, as part of Cogency IQ for CorVel, is our strategic insights management team, and that's with Michael and Mindy and myself. So our presentation today is kind of a combination of a couple different studies and white papers that we've put forth into the marketplace in the last couple of years. If we go back to 2021, we were faced with answering the question for our customers of what's not just happening with COVID claims, but what's happening in the pandemic environment. And by pandemic environment, was access to care different, our results different, our frequencies different, our severities different. So we started back in 2021 and we said, okay, the pandemic in earnest had its impact beginning in roughly April of 2020. So we decided to set out on a journey to do a study looking at claim frequencies results from April of 2020 through December of 2020. And we initially compared those results to 2019. In 2019, we knew that we had no COVID claims to compare to, but we certainly had a real full year, if you will, of claims history to compare to. So we looked at 2020, valued at the end of December compared to 2019. Well, in this year, we also did the same thing. We said, okay, we did the initial study in 2021. Let's do the study again and look at 2021 results in 2022 and use those same periods of time, April through December, normalized and valued at that same point in time at the end of December. And let's try to determine or see what we're seeing in COVID claims, but also non-COVID claims. I want to preface our presentation today by saying the data that we're presenting today is based on CorVel's book. Our book may differ from your book or your experience. You may have different industry sectors that drive your business, or the results are different jurisdictional mixes within the outcomes and results that you see, but the information we're presenting today is based on what we see at CorVel based on our overall book of business. So with that, I'd like to get started and first just simply speak to what we saw in 2021 regarding claim volumes. And this is maybe not a surprise, but we saw a modest increase in claims in 2021 over 2020, and that means medical only and indemnity claims over the same period. So there was a 6% increase in overall claim volumes, bringing everything together in 2021 versus 2020. It's important as well for me to state that this is for normalized data for CorVel, meaning we extracted new clients and so on from this data to assure that we were measuring apples to apples. So if we were to look in 2021, we experienced a 14% increase in non-COVID claims. So when we say non-COVID claims for the purpose of our presentation, claims that weren't COVID, right? Those that did not have a COVID exposure associated with them. So we saw in 2021 a 14% increase in non-COVID claims compared to the year prior. And when we explored the data a little bit more closely, we identified that the greatest increases in our non-COVID claims were emanating from the hotel and restaurant sector, along within our educational book. And, you know, anecdotally, this is really not a surprise, right? If we all think about what transpired in 2020, we saw a significant shutdown in many parts of the country, particularly in these industries. Kids were sent home, teachers were teaching remotely, the restaurants were closed, et cetera. So it wasn't surprising to see non-COVID claims in 2021 increase over their levels in 2020. In comparison, though, if we looked at 2020 book, we had experienced a 28% decrease in non-COVID claims in 2020 compared to that of 2019. So what does that really all mean? Well, for similar customers, basically we're saying the 2021 claim volumes still had not caught up with their 2019 claim volumes for non-COVID claims. In fact, they were running at about 93%, you know, from an overall frequency percentage. So I want to join or suck into this conversation, my esteemed colleagues here a bit, and I'll start with Mindy. Mindy, I know you looked at a lot of data, and when you removed the COVID claims from the 2021 Corvell book, were there any significant differences you saw by jurisdiction in the data?
Yes, Jeff. Of the 10 states listed, the biggest percent changes by claim volume in excess of 15% were in Maryland, Pennsylvania, Texas, Arizona, and Florida.
Well, that's interesting. So the 10 states you list in that chart that I'm looking at saw an increase in non-COVID claims in 21 compared to 2020, but are there any common threads within those states that saw the increase?
Yes, they were primarily driven by three industries: our public administration, our retail trade, and our accommodation and food services. Really not a surprise, as these industries are essential or frontline workers and continue to work throughout the pandemic.
Well, you've worked with me long enough, Mindy, to know that I always want to know, well, what about the opposite direction? Meaning, did we see any jurisdictions that had a decrease in non-COVID claims during that same period of time?
Yes, in fact, we did. We saw a decrease in four states specifically: Louisiana in our construction industry, Maine in our manufacturing industry, Kentucky in our health and public administration industry, and oddly enough, in Vermont, arts and entertainment. Really, to put this in perspective, though, our claim volumes tend to be lower in these states, so any changes will result in significant swings in percentage of change. Um, for example, Washington, D.C. had a 150% increase in non-COVID claims, but overall the claim volume was low.
Thank you. So at the beginning, I mentioned our study was April through December of each corresponding year of 2019, 20, and 2021. But I think we'd be remiss if we didn't talk a little bit about 2021 COVID claims in the first 3 months of 2021 and what that looked like. So, Mindy, I think you did a little bit of a analysis around those first 3 months, even though they weren't part of the two white papers. What did you find when you looked at that data?
Well, in the first quarter of 21, it accounted for 44% of all COVID claims. As in 20, industries with large proportion of frontline employees experienced the most COVID claims in 21. However, the COVID claims decreased by 38% in 21 when we compared it back to 2020. We believe the decrease was a result of more people who were vaccinated or had immunity.
So thank you. So then did you look at different industries and did any of those drive the fact that nearly half of the COVID claims in 2021 were reported in the first, say, 25% of the calendar year?
Well, Gertch, not a surprise, because 3 out of the 4 industries were healthcare, public administration, and retail trade were among the leading industries and also deemed essential workers.
See, I told you somebody would call me Gerch. There it is. Mindy called me Gerch. Yes.
That's it.
So how about jurisdictions, Mindy? Any thoughts on what may have driven these increases within our book?
Yes, we had 3 states that were responsible for carrying the 55% of the total COVID claims that were reported in the first quarter. They were California, Pennsylvania, and Florida. We have a large footprint in the public administration industry in California and Florida. And while Pennsylvania is listed, it was kind of a mixed bag. We had healthcare services, retail trade, followed by accommodation and food services.
Thank you. So let's stick with COVID claims themselves. Mindy, did we see differences by jurisdiction year over year within our book? And specifically, did the percentages coming from certain locations change year over year? And what jurisdictions did Corvell see the most COVID claims?
Yes, California had a decrease in COVID claims compared to 20, but is still the leading state within our book, followed by Pennsylvania and Florida.
So not surprising, I would say, for knowing our book distribution, but were there any surprises or anomalies within the data?
Not really. With our book of business primarily driven by essential or frontline workers, it was what I expected to see.
Okay. So There was an ongoing roller coaster of claims, different COVID variances, and at least it was pretty traumatic, scary for myself, and my guess is for many of us. But fortunately, we saw some good news within some jurisdictions realizing a decrease. So what can you tell me about that, Mindy?
Yeah, sure. New York experienced the largest decrease at 85% compared to 20, followed by North Carolina and New Jersey. Not surprising to see a large decrease in New York for COVID-related illnesses, as New York was the epicenter of the virus in 2020.
So were there any jurisdictions that saw an increase in COVID claims from 20 to 21 within our book?
Yes, Florida had a slight uptick in COVID claims in 21 compared to 20, primarily driven by our public administration book.
The good old Sunshine State.
So easy, that's my state.
So let's shift from COVID only claims to all claims reported to within the periods that we described, looking at 2021 and 2020. Mike, your turn, but what did you see when you looked at total claim volumes by industry in 21 compared to 20?
Jeff, we would like to highlight the three industries with the most significant percent claim volume changes in 20 and 21. We'll start with educational services, which had the largest decrease at 70% in 2020 as a result of remote learning. In 21, educational services rebounded with 118% increase in claim volume as the schools reopened. The second industry is accommodation and food services, which experienced a 35% decrease in 2020. Not as significant as educational services. That industry wasn't shuttered and not a remote option. We did see an increase of 72% in accommodation and food services in 21 because of the reduction of restrictions and reopening into full capacity. And the third industry we wanted to highlight is healthcare and social assistance, which saw an increase of 30% in overall claim volume in 2020, primarily from COVID claims. And in 21, healthcare decreased in overall claim volume by 14% as a result of the availability of the vaccine and the increase in immunity.
So Mike, it kind of begs the question. So 2021 claim volumes overall for these industries compared to 2019, how do those compare?
Jeff, we did compile a 3-year trend and it's on the next slide. What we wanted to illustrate here is using a baseline of 100 claims for each of the industries as an example back in 2019 and apply the percent changes to those industries. So starting with educational services in 2020, which experienced a 70% decrease, that would have dropped the claim volume down to 30, and then they rebounded 118% in 21, which would have brought the claim volume back up to 65. But it's still 35% lower than the 2019 claim volume in educational services. The second industry, accommodation and food services, using the same sample 100 baseline in 2019. The 35% decrease in 2020 would have reduced the claim volume down to 65 claims, and in 2021, 112 claims with a 72% increase. Those 112 claims in 21 compared to 2019 represented 12% increase in claim volume. Healthcare and social assistance would have had 130 claims in 2020 with a 30% increase off that sample baseline of 100 claims. And then they experienced a 14% decrease in 21, which would have resulted in 112 claims. And the 112 would have been 12% higher than the 2019 claim volume.
So Mike, we've spoken mostly about claim volumes thus far, and my favorite subject, and as Michael Combs would say, the so what. So let's shift gears a little bit as to outcomes for overall claims in 2021.
Sure, Jeff. We looked at overall average days open, and that decreased 5% in 21 compared to 20. We also looked at overall indemnity, which decreased 31%. The closed lost time average paid decreased 17%, and the closed lost time average total incurred decreased 17%.
Interesting. So I recall from the beginning, we had a 6% increase in claim volumes. Yet we saw the average days open decrease year over year for these claims, which is arguably a good story. You know, lower average paid incurred amounts are impressive and certainly can be taken to the bank, Mike. But are any comments or thoughts on my analysis?
Sure. The overall average total incurred decreased 22% year over year, largely due to the fact that access to healthcare and businesses returning to normal operations. This resulted in a decrease in overall duration and cost of claim. Also, we reported that consistent with our analysis in 2020, the COVID claims had 37% lower duration times than that of the non-COVID claims.
So Mike, you're still up. So did you look at claims that were still open at the end of the period for differences in incurred and paid values? And if so, what did you find?
We have, and the open lost time average total increased 22% year over year. That was driven by the fact that average total incurred on COVID claims doubled, but still remain more than 50% lower compared to the non-COVID claims. We also looked at open lost time average total incurred on COVID claims, which was 45% lower than the non-COVID claims. And the lost time average total incurred on COVID claims was 34% lower than the non-COVID claims. And closed lost time average paid was 71% lower than the non-COVID claims.
Great. So Mike, that's a lot of numbers, right? Wow. Right. But so two studies, right? A lot of information and a lot of comparisons. But if you were to place a bow on the two studies, are there 3, 4 points that perhaps you'd like to bring to the top for our audience?
Sure, I would. Reflecting on this next slide, the return to the new normal has resulted in 93% of pre-pandemic claim volume in 2021 compared to 2019. This is a result of the industry's returning to normal business operations, resulting in the non-COVID claim increase. The second takeaway is that as for our COVID claims, we continue to see a decrease in claim volume and attribute that to the vaccines and/or immunity. Corvell's book resulted in a decrease in COVID claims. However, COVID claims experienced in excess of a 100% increase in average total incurred, attributable to the more severe COVID cases. And the third takeaway would be that we saw significant increases in telehealth in 2020 at the onset of the pandemic, and that trend has continued throughout 2021.
Well, thank you. Thank you both, Mike and Mindy. And let me close things by saying, you know, COVID, non-COVID, the environment, there's been many downstream actions, changes, and the sort that has been a result. So, Mike, you may have said it right in the last slide, a new normal, and I don't know what a new normal looks like quite yet, and I'd be curious to know if anybody really knows a new normal just yet. But let's talk just briefly about presumptive language. And a lot of the folks I speak to wants to talk when we talk presumptive language about California and their aggressive approach to COVID being work related, defining outbreaks based on number of workers in regions, et cetera. And Corvell has a large California book. So did we see presumptive language materially drive different results there or anywhere else for that matter?
Jeff, specific to 2021, it may have been reasonable to expect states with presumptive language that would have driven an increase in COVID claim volume. However, when we looked at our book of business and compared COVID claims with our non-COVID claims, our book did not experience any disproportionate increases based on the states with presumptive language.
So staffing trends, Matt, if you'll go to the next bullet. So as businesses began to reopen, certain industries scrambled to accommodate a surge in demand compared to 2020. Have there been any implications for our customers? Maybe Mindy, you can take that first.
Yeah, sure. In our transportation business, our clients continue to struggle with filling driver positions. and ultimately had to resort to staffing or temp agencies to fill their open positions. Mike, did you see a similar trend in the healthcare industry?
Yes, Mindy, we did. Many hospitals and health systems had to resort to travel nurses and contracted employees due to the sheer volume of patients. The utilization of travel and contracted nurses continued into 21, and we are watching closely to see if that has any negative impact on other healthcare positions such as nurses' aides.
Thank you. And then for our last piece, what's ahead? Yeah, candidly, I'd like to say our fantastic AI and machine learnings models can predict the future on all things claim related, but we're just not quite there yet. Maybe soon, but we're just not quite there yet. But that said, the pandemic, the rush to open, the supply chain challenges, the talent war, the great resignation, and now wage and environmental inflation are creating significant, for some of our customers, operational challenges, and has also impacted, I should say, the TPA markets and the insurance market at the same time. So what's ahead and looking ahead? Well, I can address that at least from a Corvell perspective and what we believe as an organization is important as we look ahead in the environment that we're in. And that first piece is about care. Those of you that work with Corvell today have a model about care, making sure that injured workers get the appropriate care at the right time. We take an advocacy approach to assure that they can navigate the system. We treat people with empathy and compassion along the way. And that becomes really important if you think about not just the individual and their health, that obviously is critically important, but also critically important for our clients because they have been challenged to put people in seats and have jobs, and they want to retain their workers. And their experience within Corvell and handling their claims will have a significant impact as to their tenure, I would say, with many of our customers. The second piece that I would say looking ahead is about data collection and our artificial intelligence and machine learning models. That, within Corvell, we have the good fortune of not just being a claims organization and handling your claims with expertise, but we're also a managed care organization. We have our roots founded in managed care. So when I say we have our roots, all those services that attach to a workers' comp claim or even a liability claim, the data lands and sits within Corvell, and that becomes quite powerful with respect to being able to create models and determine when are the opportune times to touch a claim, what certain activities are critically important for an adjuster to take action. So that data collection and all this information and then being able to apply artificial intelligence and machine learning models is bringing those things to the absolute top of the pile for the adjuster, for the supervisors to say, hey, something needs to be addressed here, right? That you need to take action on these because it is going to impact the claims. And the last piece that goes along with the collection in AI and machine learning is truly about automation, communication, and the augmentation of those things. Arguably, the insurance industry has been slow to adopt some of these types of things, but the more we can do to enhance that experience for that injured worker, for that employer customer of ours, to know what's taking place, what may happen next, the more successful we will be and they will be in helping them retain their talent and also lowering their total cost of risk. So with that, I'd like to open it up for if there's any questions. Matt? As a reminder, there's sorry, Matt. I didn't know if you wanted to remind the group of the Q&A panel down the right-hand side if they've got questions.
Certainly, I think you've just done that, but just to reiterate, we are happy to take any questions that any of our attendees at today's webinar have, and I believe we'll be forwarding you some questions to field at this time, Jeff. So go ahead.
Sure. So I'm looking at a question that came in here. The question says, although 2022 is only halfway over, are there any initial observations you can share regarding trends and with COVID? So Maybe Mike, I can punt that off to you to address.
Sure, Jeff. We have started looking at the first half of 22 compared to 21. And while we previously reported that claim volume in COVID-specific COVID claim volume in 21 decreased compared to 20, we are seeing increases in COVID claims in the first half of 22 compared to the first half of 21. And the top states driving those increases are consistent with what we've been reporting in prior years, specifically California, Florida, and Pennsylvania. So far, it's frequency that's up. We're not seeing a significant increase in severity, but again, it's very early.
Thank you. So looking through, I see a question here, and Mike, I may call you out on this one as well. It says, explain the numbers cited regarding COVID work comp claims. Are there medical only claims, non-work comp claims in those numbers, et cetera? So maybe touch on, I know you looked at medical only, you looked at indemnity and so on, maybe just a kind of a highlight of what was in scope as you did some of the analysis.
Yeah, we limited our analysis to just workers' comp claims. We did not include any of the non-work comp claims, as some states are reporting on. And the majority of the indemnity claims were, I'm sorry, the majority of the COVID claims were in indemnity.
Thank you, Mike. So next question, there's a question here that says, is Corvell witnessing any changes in its book due to wage inflation or any other external factors that may have resulted from the pandemic? So maybe Mindy, I'll let you join the party. Would you like to take that question?
Yeah, sure. We did do a high overview level at our claims, and we weren't seeing a significant change in percentage in regards to inflation. Again, it's pretty early, and we intend to do more of an in-depth dive on that.
Yeah, thank you. It's an interesting time, right? That we did initially look at wage inflation early on, not something significant that we've seen. But it is early on. We'll see how the book develops. We generally know that a lot of lower wage earner employees tend to have the greatest frequency of number of claims. And if the greatest pressure on wages is at that tier of workers, then one could reasonably assume that we're going to see, some impacts down the line as the years develop. So thank you. So question here, I'll throw back out to my panel. It says, I anticipate that Senate Bill 1159 may be extended. And they're asking if we will agree, Mike or Mindy, but are we seeing less workers' comp claims being reported in California right now from a COVID standpoint? Any thoughts around that?
Jeff,
Oh, go ahead, Mike. Sorry. Go ahead.
I could speak to the volume, Mindy, if you want to speak to the bill. We are seeing a significant uptick, as I mentioned, in the first half of 22 compared to the first half of 21. So we're seeing an increase in COVID claims being reported in California.
Yeah, and I'll follow up, and we're also seeing the same in Pennsylvania as well as Florida in comparison to 21, not quite to the levels of 2019 or 2020, but we have seen a pretty significant uptick in 22.
Thank you. So a little bit of a wild card question that comes in, but are you able to delineate what percentage of COVID claims you denied compared to those you accepted? And did we notice any jurisdictional trends? Mike, I don't know if we got into that level of detail as part of the studies, but the first part of that question is, can we delineate? Absolutely, we can delineate within the data as to what was accepted, what was denied. Many times, of course, there was in many of our states, a difficult path to prove that their COVID exposure was work-related unless they were frontline workers. But we absolutely have those percentages. We don't necessarily pride ourselves on denying and accepting claims per se. So I don't think we included denial rates and so on within the study, but certainly at Corvell we have that capability. Mike, anything to add to that?
No, I agree, Jeff. We do have that data. We don't have it here for us today, but we do have that data. That is something that we track.
Excellent. There's a question in here about average cost per COVID claim for both medical only and lost time. And I'll take that from the standpoint that within each of our studies, we did look at average incurred, average paids, both open, both closed. Jurisdictionally, we looked at it many different ways as to what those averages looked like or what those numbers looked like. Within the study, we didn't report out actual dollars and cents, in part, and I'll be candid, that our competition as well may be looking at this. So we spoke more in terms of percentages and so on. But if the writer of that question wanted to contact us directly, we'd be happy to have further conversation regarding that. Let's see. There was one last question in here, I believe, that's around Cogency IQ. And the question says, can you tell me more about some of the tools and or features that we've been working on or have recently released? So Mike and Mindy, if you're okay, maybe I'll just take that, as a starter. So there's all sorts of things we're working on within Cogency IQ. A lot of what we work on within Cogency IQ are the elements that drive outcomes of claims, drive severities. One area we spend a lot of time with is litigation. Most know that a litigated claim is far more costly than a non-litigated claim. So we've developed and built tools for litigation. A couple, in fact, that I'm thinking of just off the top of my head. One is a litigation predictor or avoidance tool. That particular tool is about alerting. Matt, do you have ability to mute the audience?
Yeah, that should be taken care of.
Thank you. So litigation avoidance was one of those particular components, right? Is if we could identify for our claim staff those claims that have a higher likelihood to be litigated, what might we do differently on those particular claims to help change the trajectory or that prediction? So we've created alerts and actions within our claim system to help adjusters know that these claims have a higher likelihood and then prompt them to take specific actions. Those of you, again, that know artificial intelligence, machine learning type of attributes understand that the action or non-action actually is additional data that can be mined. So with those types of features, the system is understanding if we took certain actions, did it change the trajectory for litigation on that particular claim? And if we stick with litigation, also about making sure that our clients get the right attorney involved with the right case. So objectively, can we measure for our customers if a particular firm, if a particular attorney may have an advantage, if you will, on certain types of issues in certain venues, or maybe even against certain applicant or claimant attorneys. So that's just a very high level, one particular bucket, but most of our work, as I said early on, is around looking at those drivers of severity, usually for our clients. So I use litigation as the one example. We've done lots of work around fraud, waste, and abuse, both from a claim perspective as well as in the medical management community. And then also a lot of work on what I would call, we call claim risk score. So really understanding what claims have the greatest risk, what claims have the highest likelihood to go off the rails, right? We all know that claims generally fall within a certain bucket or range, but there's those outliers, right? So how do we take within Cogency IQ that information and project these are the claims that have the highest likelihood to come off the rails, and then what actions can we prescribe to change that trajectory. So it looks like, folks, we've touched on the questions that have come in. Matt, I think you said we're recording this, but any parting words for the rest of the group? If not, I'd like to, one, say thank you for those folks that joined today. Certainly, we know that it's a lot of numbers and information to digest. There are 2 white papers out there that can be consumed and you can review. I certainly recommend that you take the time to look at it. And if there are any questions or things afterwards, please feel free to contact Corvell or one of those on the panel today, and we'd be happy to address them.
And Gertz, just to add, you could scan the code below on the download, the full white paper with your phone.
Perfect. Thank you so much.
You're welcome.
Thanks, Mindy. Yeah, I'm sure it's not hard, not going to be easy to miss the QR code in the right-hand corner of the presentation. So if you just use the camera on your smartphone to scan that QR code, it should take you right to the full white paper, as Mindy mentioned. I'd like to thank Jeff Gertcheff and Michael Flacco and Mindy Powers for presenting today's presentation. As I mentioned, we did record the webinar. We'll be sending out a link to the recording. You can feel free to share it with your colleagues and anyone that you think might be interested in the material, or if you would like to refer to it again. Would especially like to thank everyone for taking the time to join us today, and we'd like to wish you a very pleasant rest of your day.
Thank you, Matt.
Thank you.
Bye.
Bye-bye.
Have a great day.